tension, sexual dysfunction, and a general rule for all blood pressure medications that we have to hold it or stop these medications if the blood pressure is less than 90/50. We always assess the blood pressure and any allergies before we give these drugs. So these drugs are divided into two classes, the sympathetic drugs and the RAS drugs. The sympathetic drugs consists of alpha 2 agonists, alpha 1 blockers, and beta blockers, and that is what we would be discussing now. The most of the antihypertensive drugs, they affect the systemic vascular resistance, whereas the beta blockers, they decrease cardiac output. Okay, in reflex tachycardia, what happens when the BP is low, the baroreceptors become inactive and the sympathetic system dominates. When the blood pressure is high, the baroreceptors are active and the parasympathetic system is activated. COVID virus binds to angiotensin 2. All right. Now we directly go on to prazosin. Prazosin it is a sin to forget to take this drug at bedtime to avoid first dose phenomenon. All right. What is the treatment? What are the uses? The uses are it is sin to forget this BP2 drug. BP2 this is a mnemonic. All the pink highlighted words are mnemonics. BP2 is benign prostatic hyperplasia, bladder outlet obstruction, prazosin, PTSD associated nightmares. All right. So prazosin is an alpha 1 blocker. Now some alpha 1 blockers are selective or non-selective. And what are the locations of these alpha 1 receptors? They are located in the peripheral arteries, bladder, prostate. All right. Now, orthostatic postural hypotension. This is seen in the antihypertensive drugs. What happens over here? Dizziness, lightheadedness, pass out, syncope, high fall risk for geriatric patients. Reflex tachycardia is commonly seen with antihypertensive drugs that don't work directly on the heart. So which are those drugs? Beta blockers. All right. So to treat this reflex tachycardia, we use beta blocker. What are the adverse effects of prazosin, alpha 1 antagonist? The mnemonic over here is R. All these are the adverse effects, that is reflex tachycardia, retrograde ejaculation, and first dose phenomenon seen with prazosin. Okay, now we go on to alpha 2 agonists. Which are the alpha 2 agonists? We have got clonidine and methyl dopa. Clonidine is used, this is a mnemonic over here. Clone was lonely, so he managed his ADHD and pain by using opioids. So what are the uses? ADHD, pain management, epidurals, opioid withdrawal. Methyl dopa, what is the uses over here? It is used for pregnant, hypertensive, messy ladies, MM. Alright, alpha 2 agonists, what is the mechanism of action? The mechanism of action is important over here because alpha 2 receptors are found presynaptically. These drugs, they stimulate the alpha 2 receptors located presynaptically in the vasomotor center, which results in decreased sympathetic outflow. While most hypertensive drugs, what they do, they block the sympathetic division. All right. What is the ADR, the adverse drug reaction for these drugs? Alpha 2 has D2. Okay. Alpha 2 has D2. D2 is a mnemonic over here, drowsiness and dry mouth. Then we go on to beta blockers, very important. Beta blockers, before we administer these drugs, we check for heart rate, blood pressure, and our daily weight. It is not recommended for diabetics. Selective beta blockers, we've got metoprolol, it is used for myocardial infarction, MM. Non-selective, it is not recommended for asthma, COPD patients. We've got carvedilol, cardiology purpose, propranolol, professionals to help with handshaking, stage fright, labetalol, labor and delivery uses. Now we're going to mechanism of action. Now beta 1 receptors, The selective uh, beta blockers are cardioselective, that is, they act only on the beta 1 receptors. Where are these beta 1 receptors found? On the heart, two kidneys, and two eyes. Where are the beta 2 receptors found? Now, the non-selective beta blockers, they act on both beta 1 and beta 2. So, where are the beta 2 receptors found? They are found on two lungs, one uterus, one liver, and the skeletal muscle. In the liver, what happens? These drugs, they prevent the natural defense of the liver for hypoglycemia and further worsens the hypoglycemia. All right. In skeletal muscles, the propranolol blocks beta 2 receptors and reduces the hand tremors. What are the adverse effects of these beta blockers? Bradycardia. So we stop using these drugs if the heart rate is less than 60. All right. Then it causes precipitation of heart failure, edema, masks the signs and symptoms of hypoglycemia, can cross the blood-brain barrier, so CNS changes can be seen, constipation can be seen. All right. Then we go on to adverse effects of non-selective beta blockers. What are the adverse effects over here? We can see bronchoconstriction. All right. Then further hypoglycemia. We have to notify the provider if there is shortness of breath, crackles due to fluid backing up, edema, fatigue, weight gain. What is the boxed warning for beta blockers? Very important. Boxed warning for beta blockers is ischemic heart disease. Now remember, beta blockers, they act on the heart. Okay, so it can cause ischemic heart disease. Sudden stoppage can increase the risk for myocardial infarction or angina. If the patient uses this chronically, then we must taper it down carefully. All right. Concern is for worsening heart failure. Counseling point is patients should immediately report a weight gain of 2 pounds or more in one day or 5 pounds or more in 1 week. Now, what are the nursing considerations? We recommend a beta 1 selective blocker because this may be better than non-selective beta blockers. Okay, we check blood glucose, then rely on the signs and symptoms. Then we go on to RAS specific agents. No potassium. No potassium supplements should be given when these drugs are taken. What are the first class which we are discussing over here? ACE inhibitors, the PRILs, angiotensin 2 receptor blockers, which are the sartans, the direct renin inhibitors, which is aliskiren. First class which we are discussing in RAS drugs is ACE inhibitors. What do? They stop the creation of angiotensin 2. All right. Then in this class we have captopril and lisinopril. Captopril. Captopril is unique and it is a pain in the butt. Lisinopril is commonly used. What are the uses? It is used for hypertension. It is very effective in diabetic patients and chronic kidney disease patients. Okay. Why in kidney disease? Because it protects the kidneys from proteins. And it is also used for post myocardial infarction, prevents remodeling and scarring. What is the mechanism of action over here? Higher levels of bradykinin, which causes non-productive cough and angioedema. So bradykinin is increased due to ACE inhibitors. Adverse effects. Adverse effects, again, bradykinin retention, so chronic productive cough. Then we've got hyperkalemia, so no potassium supplements should be given. Angioedema, as in the picture over here. Boxed warning. What is the boxed warning for ACE inhibitors? The boxed warning for ACE inhibitors is injury and death to a developing fetus. All right. And it is not recommended in pregnancy. Now, which are the main adverse effects seen mainly with captopril? Now, physicians usually run away from captopril. Okay, it's the unique drug. So, physicians ran, and this is ADR, rash, altered taste, neutropenia. What are the drug interactions for these drugs? ACE inhibitors. This is important. The drug interactions is hyperkalemia. Okay, and seen with sulfamethoxazole trimethoprim. Additive hypotensive effect seen with diuretics. Lithium poisoning toxicity seen because it's a narrow therapeutic index drug. And what do COX inhibitors and NSAIDs do? They decrease the effectiveness and increase risk for acute kidney injury. All right, which was explained over here in this diagram. Now, angiotensin 2 receptor blockers, ARBs. ARBs are sartans. This is the suffix sartans. They block the angiotensin 2 from binding to the receptors. This is the mechanism of action over here. The uses and the EDR is the same as ACE inhibitors. Then we've got direct renin inhibitors. These stop the conversion of angiotensin nogen to angiotensin 1. And this is aliskiren. This is not used often since it's a new drug, and the uses and the EDR is the same. That's it.